In this session, it's my pleasure to introduce our first speaker, Carol Abade. And Carol is a Kenyan by birth. She currently lives in South Africa, where she is the group CEO of EXP Social Marketing. EXP Social Marketing is working in over 17 African nations to apply successfully something they call experiential social marketing, a sort of multi-dimensional focus on literally stepping outside of dependence only or just on commercial marketing techniques, but really introducing into the toolkit of success and improving the lives of people across 17 nations in Africa, a concept called experiential social marketing, and that's what she's going to be talking to us about now. Carol?
Thank you very much. Good afternoon, everybody. When we were asked to be part of this conference by Jeff and his team, we were pretty excited because we recognize that we work in a continent where the issues that we deal with every day are real social issues. Not to take away that, the rest of the world doesn't have social issues. But the amount of money that's spent every year on social programs within the continent requires a sense of responsibility that far exceeds just the understanding of what social marketing is and how to actually change lives, much more than just change behavior. The top 10 donors spend about $17 billion on programs within Africa that goes from, obviously, covers behavior change communication to supply issues to product to everything you can think of, really. And we've been fortunate as a business over the last 30 years. We've worked on commercial marketing with a lot of the multinationals, and in the last 25 years have developed a key understanding of what our needs are within the continent from a social marketing perspective. And what I'd like to do today is probably share some of those learnings with you with the hope that we can come out of here with a different thinking in terms of how to approach behavior change communication and how to probably look at what the role of commercial marketing is in behavior change communication within the context of the African market. So there's been a lot of talk already about behavior change and commercial marketing techniques and principles and how one leads into the other. And we truly believe that we cannot divorce marketing from social. Yes, there is the issue of enterprise, and I think that discussion is even more real within the continent about what the responsibility of enterprise is to social issues. But when we look at the way social marketing has developed over the years, we think that there is a role for commercial marketing to play, and yet there is still another role that as social marketers, we have to start to dig a little deeper into our discipline to be able to affect real change in the people that we actually care about. So I think that the most important thing that I took out over the last 2 days is that there is already a consciousness and there is already an acceptability that the discipline of social marketing is going to evolve into a much bigger space. Now, where we come from is that we practice what we call experiential marketing, which is, technically a form of marketing, as it were, but it's really on looking at experience-based and how people's experiences shape their behaviors, and how by understanding people's experiences every day, we're in a much better position to allow them to go through a behavior change process. And I think to achieve this is going to require questioning some of the tenets of commercial marketing techniques, and that's what we found out, is that where we applied real commercial marketing techniques in every single one of our behavior change programs, our success rates in those markets were sometimes good, sometimes not so good. There was really almost no science behind it, and we couldn't underpin what actually works and what doesn't work beyond just the everyday kind of measures. So I'm going to address probably 5 or 6 of these commercial marketing truisms, as I'd call them, and look at where we've challenged them, and where we think that they can go to become more effective for behavior change. And whilst I don't want to knock commercial marketing, I think that the messages can really be replayed in a different form. The first one is the classical truism that says, I see your message and I respond to your content. And this has really been based off the basis of what advertising does and about the pre-to-picture. And whilst it seeks to change weak opinions into strong opinions, it doesn't seek to change how people feel. And we think how people feel is of far greater influence than what they feel, and is of far greater influence than what they see. And so this is the first truism that we take out of our strategy building when we're talking about behavior change communication, and rather go with this approach that says, I recognize and empathize with my content, and therefore respond to your messaging. And this is the bottom-down approach that says that we've got to understand where people come from, what their experiences are, and what their cultures are, and allow them to create the content for them to actually fast-track the behavior change. And if we do this, every time we've used this model in designing communication, we've very quickly gone past the traditional model that says we create strategy, and on the back of strategy, we come up with messaging. And once we come up with messaging, we go to market, we test the message, and then we come back and refine the message. What this does is it says, we don't have to refine this message because this message wasn't created by us as marketers, but it was created by the people who the content is meant for. And that brings me to the second issue, which is relevance. And what we've found is that we work in an extremely cluttered media space. And it's cluttered. In the African market, for example, our competition is not other social messages. Our competition is the cellular companies. Our competition is the Coca-Colas. Our competition is the commercial marketing agencies that can spend more money and make prettier pictures and drive persuasion more than they can spend, more than we can ever expect to spend on social issues. And the second thing is that the complexity of the donor funding model within the continent means that there is competition within the social messages. So we'd find I'd take an example of South Africa, maybe 10 years ago, you all remember the HIV scenario, where there was one school of thought that said, let's focus our spend on abstinence, for example, and another school of thought that says, actually, no, let's focus our communication on eating garlic and potatoes and having a healthy lifestyle. And another school of thought said, actually, no, let's spend our money on drugs. And all these three messages went out into the marketplace, even further confusing the target that we were trying to address. So relevance is a really critical area of the behavior change communication strategies. And we can't build relevance unless we have a completely different approach to our media planning. And the commercial approach to media planning is not going to work in the behavior change strategy space. What that means is that we can no longer, as behavior change specialists, use reach as a measure of efficacy. And that's what every day we get told. How many people did you reach? So what does it matter if that was not the objective? My objective was not reach, my objective was change. So how do I start to measure change? So the first thing we threw out was that reach cannot be used as a measure in behavior change communication. It's a classical approach that says the medium is the message. And what that says is that when you got television, you got radio, you got all the other medium, and the message embeds itself in the medium, and ultimately people consume the message on the basis of the medium that you put it out to. Where we come from is that the experience is actually the message, and the message is the experience. For the very simple reason that when we're designing behavior change communication, your experience-based reality has a much bigger role to play than the medium in which you are consuming the particular message. And it's a difficult thing to plan. We found it where the force has always been measurement becomes a key tool in determining the program's success. And the real measurement that's come out is always because we can easily read what TV does. We can talk about impressions. We can talk about how many outdoor hoardings went out. We can talk about how many posters we printed. What we can't talk about is how deeply we engaged with our audiences. Because perhaps as a social marketing discipline, we haven't yet gotten to the point where we start to measure real behavior change in terms of the engagement levels and the level of depth. And I think that's some of the conversation that we've had over the last 2 days is how do we start to evolve as a discipline so that we are allowing ourselves to create the measurement systems that can measure the very thing that we're thinking to do, as opposed to borrowing the measurement system that comes out of a typical marketing background. So I'd like to share with you a case study of work that we've done in Ghana. The reason I want to share this case study is because it was a social marketing project that had 3 areas. It had what we heard yesterday as the upstream, so we're talking about advocacy, the midstream, and obviously the downstream where we came up with behavior change communication. And the challenge we had was how do we effectively combine all these 3 things to have a campaign that actually resonates within the context of the market in which we're operating? So it's not very long.
In 2010, the EXP Social Marketing Foundation was contracted to manage the social marketing of USAID's donated contraceptives to the private sector. The environment at that time showed an extremely low level of contraceptive use, as low as 17%, according to the Demographic and Health Survey of 2008. The reasons for low use were many. The social stigma around the use for women who had not had children or were unmarried, coupled with a strong gender bias in the community, where men were often the gatekeepers. This contributed to restricting access to contraceptive methods. Added to this was the public health bias at the time and the low political, traditional, and religious support in the community, as well as superstitions, myths, and misconceptions, all contributing to the challenges facing the project. USAID and the EXP Social Marketing Foundation identified 3 main objectives for the project aimed at addressing these challenges. These were to increase the demand for contraceptive methods, to increase the access to contraceptive methods through improved distribution and retail coverage, and to look at improving the sustainability of contraceptive brands, moving them away from a donor-funded model to a commercially affordable and viable model. To achieve these objectives, the Foundation's strategy focused on 3 main pillars: to build behaviour change communication campaigns that would make use of innovative experiential marketing elements aimed at personally engaging the audience, which would in time drive the increase in demand for contraceptive methods. Secondly, by improving the distributor capacity to increase the number of outlets stocking the project's contraceptive brands, the accessibility to the contraceptive methods would be addressed. Finally, through a strategy to launch 2 new cost-recoverable brands, the project hoped to make contraceptives affordable and sustainable. The tactical rollout of the strategy focused on demand creation. A 360-degree experiential approach was adopted to start and drive discussions around family planning. This was implemented across multiple channels, including brand-sponsored generic family planning radio call-in programs hosted by the Ghana Health Services. Each resource person was provided with a mobile phone and a dedicated line which was advertised during these radio shows, extending the link beyond the radio time. Roadshows, market day activations, and community festivals which provided personal engagement with the target audience. The activation made use of edutainment and messaging together with a mobile clinic run by the Ghana Health Services, providing the opportunity for the audience to get more information and counselling. The program focused on involving health providers, motivating them personally, and adding credibility for the audience. EXP Social Marketing sponsors a variety of activities during the festival and promotes trial and use of its 2 brands, Protector and Challenger. These promotions include sponsoring football tournaments, boat racing, nightclub events, and bar activations. The results of the project were as follows. The project contributed to the couple's year's protection, or CYP, of 1,258,999 over 2 years. This increase in CYP in a developing country context is estimated to have prevented 262,572 unintended pregnancies and 27,409 unsafe abortions, as well as 668 maternal deaths. A major contributor to nationwide 6% increase from 17% in 2008 to 23% in 2011 in CPR, thereby reversing the trend of declining contraceptive use. CYP grew from 270,000 in 2009 to 495,000 in 2012 from 3 short-term methods. Increased retail coverage for 2 methods by more than 24%, universe of outlets approximately 12,600. A key element of this program was sustainability, and the project successfully launched 2 cost-recoverable brands and managed the price increases of those brands, allowing for a reduction in the subsidy and ultimately moving the brands towards commercial sustainability. If you would like to...
Okay, I'm going to end there. I think that the results of this particular program are unprecedented in many respects, and the responsibility that we have was to build sustainable models, that when the subsidy went away, the problem would not go back. And I think that's the biggest challenge that we've got within the continent and all the people that are working on social marketing projects, is that as the spend and as the pressure, the economic pressure increases, we're going to have less money to spend on social problems. And so the onus is on us to try and start building sustainable models that can go beyond the lifespan of a particular project or problem or whatever it is that we're dealing with within those markets. And the Ghana case study actually brings me to the next marketing issue, and that's the media selection strategy that is currently applied in your typical commercial marketing. And I'm not saying that there is no role for traditional media. I believe there's a role for television. I believe there's a role for radio and outdoor and every other one of the traditional media components. I think that they do have a role to play. But I think that in a lot of the communities that we work with, where we're trying to deal with behavior change, we've got to change the way that we start to apply media planning if we're actually going to become effective. So if you look at where the experience sits in the whole bulk of media, and this was a study, I think, done by Jack Morton, that says people tend to remember 90% of what they do. And that's the basis for experience marketing, is that when we tap into people's experiences, which includes their cultures, their social norms, their environments, we tend to find a greater correlation and an ability to engage more emotionally with their needs than when we do typical traditional media advertising without the engagement factor. So what that says to me is that the next truism, audience cost per contact, is the core in media selection and strategy. And audience cost per contact is another key measure that we're using as social marketers every day. The question is, what was the cost per contact? If awareness is your objective, then cost per contact is a real measure. But if behavior change is your objective, then contact is actually a meaningless measure in the behavior change funnel. And this is one of the things we need to do away with as behavior change specialists. I don't have the answers to this one, but I think the depth of reach and meaningful engagements are a lot more core to behavior change than our cost per contact. And I think that this is where we need to come together as a group to develop real meaningful measurements that can give us a real measure of what does behavior change go through. And is behavior change only at the end of the change of behavior? Is the results of the program sometimes measured in between in terms of where we are in the spectrum of behavior change? I don't know, but I'm going to leave it out to the rest of us to figure that one out. The next classical approach is that every time we send out a message, we believe that the message has been received. So we go back to, again, the same theories, is that what we do is we flight television and we flight radio and we put outdoor and we say we've put it out there so people have seen it, and we expect them to make the emotional connection between their experience and our message, and therefore affects behavior change. But I think that experience is equals to the message sent, which is equals to the message owned. So it's about ownership of the message as opposed to receiving the message. And behavior change communication needs to move away from just we put out X number of television ads or we put out X number of radio commercials, and so therefore we reached X number of people. And the next one I'm going to share with you is a case study that came out of Tanzania. The realism of this study for us was that we assumed that there was a social problem. And if we applied commercial marketing techniques to that social problem, it would have been quite simple. Is we already know that there's a problem, so we've got a problem statement, and now we need to go and find a way to fix the problem. And what came back to us was actually what we thought was a problem was not a problem to the audiences that we were talking to. And we needed to understand that realism and to start to engage with them to explain why it was a problem in the first place. So I'll let this one speak for itself.
In 2008, the World Bank Water and Sanitation Program of the Africa region, funded by the Bill and Melinda Gates Foundation, ran a program known as the Total Sanitation and Sanitation Marketing, or TSSM. Around 2/3 of rural Tanzanians use unsanitary or shared latrines, with 5.4 million having no access at all to these facilities. 18,500 children die every year in the country from diarrheal disease, and $206 million, representing 1% of GDP, is lost annually due to premature death, illness, lost time, and productivity. The program aimed to bring together the private sector and the community in providing affordable solutions. The goal of this program was to increase improved sanitation coverage in identified rural markets through a community-based communication strategy that would move target audiences from passive understanding to an active behavioral change, strategies to personally experience the emotion that brings about behavior change. Through these immersions and the use of EXP's proprietary Sixth Sense intervention tool, respect in the community was identified as the most important social need. A strategy was developed to link sanitation as being essential to status and the aspirations of the community, using a bottom-up approach and engaging public sector, private sector, and the community. The message was developed to drive the heads of households to improve their latrine management through the improvement of their latrines and by extension improving their status within society. This also helped them become better providers for their homesteads through the improving standards of living and lifestyle at home. The big idea was experientially driven through behavior change communication roadshows, educational theatre through locally produced radio programs, community-led total sanitation forums within communities, the creation of a supply network engaging businessmen at hardware stores, and capacity building with local government authorities to drive community declarations and verifications. The project ran until 2011, and the following results were recorded. 212 communities declared 100% improved sanitation. 6,102 sandplast were sold during a 3-month period, a 12% improvement. 16,642 households gained improved access to sanitation improvement. Various learnings were used to scale up the program through the Tanzanian Ministry of Health and Social Welfare. This was done by coordinating the implementation of the National Sanitation Campaign, which was launched in June 2012 with the objective of getting 6.5 million people access to improved sanitation by 2015. To find out more, visit us.
So what we realized is that the classical marketing approach that said increased awareness would result in increased usage was actually incorrect in this particular case. Sanitation was not a real problem, was not seen as a real problem until we presented it as a problem at that point. And so we think that the experiential residue relevance is key to targeted messaging. So when we moved away from targeting a sanitation program into targeting a status program, then we were able to effectively get people to start to think about sanitation as a need within the community. I'm going to talk very briefly about the issue of hypersegmentation, because I think segmentation and hypersegmentation has been used a lot within the marketing space to be able to lead to, I suppose, better value propositions, customer service, increased customer service, targeting people in the right way. And I really believe that in many ways, perhaps hypersegmentation is not right for our discipline, and that there has been a lot of influence on community and cultures and a sense of belonging that have a much bigger impact than the individual in behavior change strategies. Now, I don't have the science behind that, and I'm going to leave that to the academics to try and figure out, but what we found is that in many cases, the community has a much bigger impact when treated collectively than the individual has when we actually segment them into what their needs are as individuals. And that brings me to my last case study. Am I good for time?
The World Bank estimates that more than 1.6 billion people worldwide lack access to electricity. In Kenya, 86% of the population have no access to grid electricity. This forces them to rely on expensive and polluting sources of energy for lighting, using mainly kerosene. Lighting Africa is a joint IFC and World Bank program focused on mobilizing the private sector to build sustainable markets to provide affordable, modern off-grid lighting to communities across Africa who are not on the electricity grid. The program had achieved substantial results but needed help in achieving its intention of increased energy access and better lighting to a target of 250 million people by 2030. To address this market barrier, EXP Social Marketing was briefed by IFC Lighting Africa to conduct a targeted consumer education campaign. African consumers are often discouraged from purchasing off-grid lighting products due to a lack of reliable information about economic and environmental benefits. The challenge was to bring about a continuous behavior change by educating individuals, households, and small-scale businesses on the benefits of adopting modern off-grid lighting technologies. The main aim of this program was to have consumers believe that the modern off-grid lighting technologies offer them an improved quality of life, safety, reliability, reduced cost, cleanliness, health, and environment. To do this, EXP Social Marketing needed to demonstrate the following. Firstly, what the value to the family would be by adopting solar lighting. Secondly, how to use different products. And finally, what steps are needed to take action for change from kerosene to solar lighting. Through the use of its sixth sense intervention tool, EXP Social Marketing developed a communication strategy aimed at moving the target audiences from passive understanding to an active behavioral change. To ensure that the communication strategy was relevant and that it resonated with the target audience, EXP Social Marketing employed a bottom-up approach which involved the use of immersions, revealing key insights on the consumers, and these guided the communication tone and content. The same approach was used during the rollout phase so that consumers felt they had been invited to participate in every stage of the process, and so felt empowered and involved in the behavior change model as they knew the initiatives were self-driven. The big idea was carried out through market storms, trade outreach, pop-up retail, edutainment through roadshows, and forum sessions. Through the EXP Social Marketing program, the following results were achieved: a 300% growth in retailers stocking the product, and a 72% growth in sales. The program and its partners have brought cleaner, safer, and better lighting to 3.8 million people. Lighting Africa aims to increase energy access and provide better lighting to 250 million people by the year 2030.
Thank you very much. I think the last thought is that what we have learned working within the markets that we work in is that unless we cross the street and live the way the people that we're talking to live, we have very little chance of getting them to change behavior. Thank you very much.
Do we have a question or two for Carol? I thought I was moved by the great success you're experiencing and so hopeful for the future. A question or two. Any hands? It's hard to see from up here. Carol, I think you may be off the hook. Thank you. Oh, there's one, okay. Maybe there's two.
Hi, George Perloff here. Just a quick question. I love what you presented, and traditionally, I think we, as marketers, look at experiential marketing as just something that's wonderful. We'd love to do it, but it's so expensive. And how do you sort of work around that and make this not as expensive to people, and then work into other, with other models and other communication strategies?
I think the biggest challenge we've got is that we're measured as expensive in relation to other media. And that brings me back to the whole discussion about cost per contact. And if we start to measure contact through the lifespan of what you're bringing about, so if you change one person's behavior for the rest of their life, then technically that's what you should be measuring as a cost. What happens is that the programs are measured on the basis of the life of the program, and we need to start changing that sort of thinking that says, if we're bringing about change, then our measurement should be based on a lifespan and not a contact at that particular point. So it is expensive because you're talking about one-to-one engagement, but it's expensive in relative terms when it's compared to other media.
Was there another hand? Oh, over here, all right.
Shigamu.
Marhaba.
Asante-san. I would like to say, first of all, thank you for your wonderful presentation and congratulations on the great work you've done. My name is Winthrop Morgan. I'm president and founder of the International Social Marketing Association, and I am also the former director of the Together We Care campaign in Ghana, which preceded yours, and also a director of campaigns in Tanzania, which also preceded the ones that you've done. What you're doing is wonderful, and it's getting great results. What we need as an entire community is to remember that we are not the first ones to have done this. What we are doing is social marketing. All of us, what you're doing here has been done before, and you're doing social marketing very well, as we've done it before. We shouldn't be saying commercial marketers are doing it wrong. They aren't. I have worked with commercial marketers in Ghana doing exactly the same things that you said you've done, not only on the radio, but out there in the field one-on-one. And the same thing in Tanzania. So I would say, let's keep saying the great things that we're doing, but let's not say commercial marketers are doing it wrong and we're doing it right. Let's talk about how social marketing is doing things right and build our entire experience of social marketing. Thank you.
Comment?
I don't really have a comment on that, but thank you.
All right, thank you very much, Carol.